Here are the 4 advantages to the anterior approach to the hip for hip replacements. Hello, I'm Dr. Dan Albright. I'm an orthopedic surgeon in practice since 1994 with an emphasis on anterior hip replacements. The first advantage, big advantage, is less dislocations. Almost 8 times less dislocations than the posterior approach, according to one prominent study published recently. So dislocation is a huge threat in hip replacement surgery. A dislocation is when the ball comes out of the socket. It's very painful. If it happens at home, you have to get in the ambulance, call 911, go to the hospital, sometimes go back to surgery, go to sleep, pop it back in, wear a brace for 3 months or 2 months. So it's a big deal. You want to avoid dislocations in the anterior hip. I have no precautions after surgery. It's a strong way to do the hip replacement, and I don't worry about dislocations because of the approach. So the biggest advantage is far fewer dislocations. The next advantage is muscle sparing. Or with the approach from the front, you split the muscles. You don't cut any muscles. You don't cut any tendons. With other approaches to the hip, which can work long term, but those other approaches, typically you cut muscle and tendon and then stitch the tendon back to bone, and patients feel that. And there's sometimes more instability from that. So splitting the muscles, I believe, and sparing the muscles is an advantage. And at the end of surgery, the muscles just flop on back and you don't stitch them. The third advantage is I can see both hips during surgery. You're supine, you're flat, which is unusual. That's the anterior approach. You're flat on the bed, supine. And I'm using X-ray fluoroscopy, and I'm looking at the operative arthritic hip and the other hip, and I'm comparing leg lengths, and X-ray allows for precise placement of implants. It's a real advantage to do this under real-time fluoroscopy, pounding in the socket, putting in the femoral stem. So fluoroscopy live X-ray is a nice advantage to the anterior approach, looking at both hips. Last advantage is I use a special table, the Hana Table, and it's designed specifically for anterior hips, and it makes my job a lot easier, more efficient, more precise. It's nice to have the right tools to do this. If you're interested in learning more, I'm happy to see or meet with you. Please call the appointment line.